Hello, I'm Larry Warren. I'm CEO and founder at Clear Passage Physical Therapy, where we regularly treat and save lives for people who have recurring small bowel obstruction, SBO. Okay, with the small bowel obstruction, generally your intestines, your bowel, get adhered with internal scars called adhesions that block food from going through. You have to have food to live. If food can't go through your intestines, you're going to die in 100% of cases. There are only two things that we know of to clear a total bowel obstruction when things are totally clogged, and that is clear passage physical therapy or surgery. Surgery can be very effective, but the problem with surgery is it creates more adhesions in over 90% of the cases, and your doctor will tell you that. So men, women, and children all get bowel obstructions. Men have a particular susceptibility to getting physical bowel obstructions from physical trauma, from either working dangerous jobs or through rough sports, or they're adrenaline junkies. Oh, I think I'll try that. That sounds like, oh, that didn't work out too well. Gosh, now I got injured pretty badly in my abdomen. First thing that happens after a surgery, an injury, or an infection, Crohn's, diverticulitis, ulcerative colitis, endometriosis, the first thing that happens is tiny strands of collagen, very powerful, like the strands of a nylon rope, come rushing in and start laying down in a random pattern on each other to surround the area that's been injured, so that then your white blood cells and your immune system go to work and you heal. Once you've healed, that's great, but the adhesions, which are around 2,000 pounds a square inch, so you can lift a horse with a square inch of adhesions, the adhesions that formed to start the healing process are with you for life, and they stay there and sometimes grow if there's more inflammation over time. If you have a bowel obstruction that occurs, the first thing that you'll feel is incredible pain. You're writhing on the floor in pain. You know that you have to get to the emergency room. You go to the ER, the doctor or the nurse there first puts an NG tube, this clear plastic tube, through your nose, goes down your esophagus into your stomach to pump out any contents of your stomach. And that tube remains in you for as long as it takes until that hopefully clears. If that obstruction clears, and it may take hours and it may take days, the average hospital stay with SBO is 5 to 7 days, totally interrupting your life. You're lying there in bed with this tube in your nose, which is pretty uncomfortable, and no food, no hydration. You get your hydration and your food and medications all intravenously. Okay, they may allow you to suck on an ice cube, but that's pretty much it. You're sitting there wondering, am I going to be able to go home because this thing will finally clear, or am I going to have to undergo surgery, or am I going to die? So luckily, in a lot of cases, it does clear on its own. If it clears on its own, great, I can go home, but the doctor says, caution you that nothing has actually physically changed anatomically in your body. This could happen again at any time, next week, next month, next year. So, and it could happen again and again because nothing has changed anatomically. If you do have surgery, that's great. The doctor says, I was able to cut out the bad section, throw it away, rejoin the pieces that are good. Now you're good to go. And but the problem is that surgery is the primary cause of bowel obstruction. So what I just did to repair you is the primary cause of the next obstruction. This could happen again next week, next month, next year. So the other concern is that sometimes when the doctor cuts, a little drop or two that they don't even see will leak out into the warm, moist, dark area of the interstitial spaces of your body. Bacteria look around and go, oh my God, perfect place for me to grow, and bacteria start growing. So 1 out of 5 people, or 18%, return to the hospital within 30 days after a bowel obstruction surgery. Okay. The other problem, if your doctor has ever said to you, I just don't want to go do another surgery again, If it's going to save your life, I will, but I don't want to. It's because the adhesions are so thick that he or she cannot see them and is worried about, gee, I might cut through the bladder or another part of the bowel or the stomach, so I don't want to have an inadvertent enterotomy. A surgeon at Harvard was facing these kind of situations with her patients and started referring us her most complicated cases, the ones that she didn't want to risk cutting through another organ and have to face just a massive wall of adhesions. She moved from Harvard to Stanford, where she's now teaching and doing surgery, and a doctor from Washington University in St. Louis did a controlled study of patients with recurring bowel obstructions. We took well over 100 patients that we did not treat that were having recurring bowel obstructions and put them in one group, and then we had a treatment group, the same 100 plus patients that we did treat. So it made a controlled phase 2 study, a very high level study. The ones that we did not treat, 15% of them had another obstruction, total obstruction, within 90 days after they entered the study. The ones that we did treat, only one did, so less than 1%. So we decrease recurring bowel obstructions by 15 times the norm. That's pretty much the story of bowel obstructions and a slight focus on men that we treat. So that's it. Thank you very much for your time and have a good day.